I'd say the thing I value most is kind of individualized medicine and patient autonomy. Um, you could have two patients with the same diagnosis, and the treatment plan may be completely different. If things I take into consideration are treatments they've already tried, um, other things they have going on in their life, other medical issues that they may have, and so it's not a one size fits all approach. So I tend to lay out multiple treatment options and really have a discussion with the patient to figure out what makes the most sense for them with what they have going on in their life and kind of where what they're ready to do at that time. The bulk of my practice is in call it spine and sports medicine. So a lot of back pain, neck pain, and arm and leg pain associated with that. And then sports medicine, getting to treat, joint injuries, tendon injuries, uh, ligaments, nerves, all that good stuff. I get to do X-ray guided procedures, mostly for the spine. I get to do ultrasound guided procedures for joints and tendons, nerves, things like nerve blocks. I also do some neuromuscular medicine, so electrodiagnostic studies as well as neuromuscular ultrasound for peripheral nerve injuries, and I'm involved with the peripheral nerve injury clinic. So I get to do a wide variety, and I get a lot of tough cases that need some more kind of diagnostic acumen to figure out what's going on. So if you have some tricky cases, send them my way. Well, maybe not so much a physical exam maneuver, but maybe just a physical exam sign. So what comes to mind is, quite often we have patients with kind of neck and shoulder pain radiating down the arm, and it's kind of, the common things would be, is this a cervical radiculopathy, or is this more of a rotator cuff issue? And the sign to look for, I would say, is Bacody's sign, which is a relief of the symptoms if the patient is carrying their arm, across their body or over their head. And that would be suggestive of more of a cervical radiculopathy because that takes tension off of the nerve. The opposite of that would be a rotator cuff issue. Those patients don't like to lift their arm up overhead because it impinges more. So that's kind of a good clue to help tease those two diagnoses out. The most helpful thing to know, and the main reason is because this is something, it's a box that insurance wants us to check before ordering imaging, is, have patients complete 6 weeks of physical therapy before we get an MRI. So we can usually get an X-ray early on, but to get the MRI approved, they usually need to have completed 6 weeks of physical therapy, and usually a trial of a couple weeks of a prescription strength anti-inflammatory. So having those boxes checked before you order the MRI helps set everything up for when they come see me, so we can make a good plan and get them feeling better. I often get a lot of referrals for back pain. It's being as common as it is. But I also work at the foot and ankle clinic, so I treat lots of foot and ankle kind of sports injuries there. But in general, I also can see any sports injuries. So sore knees, sore hips, shoulders, you name it. Um, uh, with my ultrasound background, I can kind of perform any injection that we need, and uh, as well as, if there's, maybe someone's had a nerve injury in the past and we're trying to figure out how well that nerve's recovering, that's something else that I can see as well. A couple different things. Probably the most popular one would be PRP, or platelet-rich plasma. And so we can do injections into joints or tendons mostly. And then the cool thing that's new that we're doing is intradiscal PRP. So actually injecting into the lumbar discs for people with chronic back pain from a disc injury. And then the other thing that I can offer is shockwave therapy. And so we have a shockwave machine at the Foot and Ankle Clinic in Central Park, and we usually use that for chronic tendon injuries. So plantar fascia, Achilles, but we can, any other part of the body, elbows, knees as well.